Time to move on to our next systemic fungus, Blastomyces dermatitidis, which causes blastomycoses. We've called this drawing the blast of the cannons, which will take place during the Civil War era. Not just because cannons were used in the Civil War era, but because the geographic distribution of blastomycoses very closely overlaps the location of Civil War battles, the southern and eastern United States. Its distribution actually has quite a lot of overlap with histoplasmosis. However, the geographical buzzword for blasto will be the Great Lakes and Ohio River Valley. So we've drawn the battlefield on a valley. This valley and the river should make you think of Ohio River Valley. Okay, now let's look closely at this map that this soldier is holding up for us. We really threw it in just for quick reference, because sometimes it's difficult to differentiate the geographic distribution of histo and blasto, but you'll notice that blasto is present around the lakes and along the east coast. Recall that histo is further south and not really touching the coast. So again, buzzword alert. Hear Great Lakes, think blasto. Another similarity it shares with histo is that blasto is a dimorphic fungus that changes form with different temperatures. It's a mold in the cold, or in this case soil, and a yeast in the heat, i.e. our bodies. So we're going to draw in our dimorphic butterfly to signify this dimorphism. So this fungus that lives in the soil and dirt has the potential to become aerosolized, and then get inhaled, and then assume the yeast form once it's colonized the lungs. We're conveying the idea of inhaling the spores by having the cannon fire causing smoke, and then this smoky air is being inhaled by the soldier here, and he's coughing as he inhales it. Once inside our bodies, blasto replicates through budding, specifically single broad-based budding. To symbolize this broad-based budding, we've drawn some newly designed cannonballs that are fused together in pairs. This mimics the appearance of blasto yeast that are budding off each other with a broad base. And if you can picture these cannonballs on tests, you should be able to pick out blasto on a smear. Lastly, we need to mention the size of blasto in relation to an RBC. Do you remember what we said about histo's size? Yeah, that said it's smaller than a red blood cell. Remember we said macrophages contain like tens to hundreds of histospherules, and macrophages are only slightly bigger than RBCs, so naturally histo can't be as large as a red blood cell. Blasto, on the other hand, are very large, and on a smear, they appear to be about the same size as a red blood cell. Now that we've drawn a parallel between blasto and these cannonballs, let's see what these cannonballs are doing. They're landing out in the valley, which is cracked and dry, and look what shape the cracks have taken. They're actually forming the outlines of lungs and lung lobes. And we've drawn in some cannonballs landing in the lungs. All of this firepower has caused the valley to become hazy, which incidentally is what happens to the lung on chest x-rays. Blasto infection causes the lungs to have a patchy alveolar infiltrate, or in other words, haziness. Additionally, the landing site of each cannonball will represent lesions or cavities, which may also be present on imaging. This pneumonia can be acute or chronic and is considered a local lung infection. But this infection can spread to other organs, especially in the immunocompromised. Hence, this is why blasto is known as a systemic fungus. But realize that the majority of infections are actually subclinical or asymptomatic. Now we're adding a statue of Robert E. Lee, which of course can help remind you that blasto occurs in southern United States, and not just around the Great Lakes. But we also have him here to demonstrate the symptoms of systemic infection. And I just said that we really only see these systemic effects in the immunocompromised. So let's add our symbol for the immunocompromised state and have General Lee holding a cane. Secondly, you'll notice that there are chunks of him missing. These little craters will represent the disseminated infection. Dissemination of blasto from the lungs is most likely to occur in the skin and the bone. So now notice that the statue has several ulcerating craters. Furthermore, you can see this iron rod in his leg is exposed, which is meant to symbolize bone involvement or osteomyelitis, a possibility of chronic blasto infection. I think this is a great way to remember blasto symptoms, because if you think about this statue's body getting nailed by shrapnel, it really should sink in that naturally it damages the skin and bones. Like we mentioned in the previous video, diagnosing systemic fungi can be done in a couple of ways, either through a KOH prep or through culture. With the KOH stain, you'll see the round yeast with the single broad-based bud that we've shown you with these cannonballs. Additionally, blasto can be detected through a urine antigen test, just like histo. To help you remember this, we're going to turn this river here yellow, like the color of urine. And lastly, treating blasto is also similar to treating histo. We use azoles for local infections, such as itraconazole. We'll demonstrate this with pine cones for itraconazole that are scattered around on the side of the drawing with our non-immunocompromised soldier who's just coughing, which represents that he has the local pneumonia. So you'll give immunocompetent patients with the local infection azoles. We'll show the treatment for disseminated infections on the other side of the drawing surrounding the statue. And the drug you would use for a severe systemic infection is amphotericin B, which, if you remember, is symbolized through amphibians, or frogs, the amphotericin amphibians, which we'll draw around this immunocompromised statue. Poor Robert E. Lee. Today's just not his day. But it is your day, because you just learned blasto in 6 minutes. Congratulations. Stay tuned for our next video on coccidioides.